Good evening and welcome to our COVID-19 update, a special edition on Channels Television on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. Here are some of the highlights this hour. Today, Nigeria's president gives hope as COVID-19 spreads to 16 states and the FCT. Secretary to the government of the Federation says his position in the Presidential Task Force on COVID-19 has given him a broader perspective on the health sector, calls on states to join the fight. And fear grips states in the United States as it records more coronavirus cases than any single country. Glad to have you join us on a Good Friday, and to all Christians, greetings from Channels Television, your home for the news. We begin this evening with this sad report coming in from China, where Nigerians living there are maltreated by Chinese authorities. Here's a look at this video, which has gone viral on social media.
14 days, the first 14 days is acceptable by us. Another 14 days, you didn't communicate to us that you are going to do another 14 days after 14 days. They have tested negative and then they have given them the paper. Why are they giving them another 14 days? That is one. Two, all the police, the documents, this passport belongs to the federal government of Nigeria. In line with international practice, no any country have the right to seize the international passport of another country. Wait! They are not in my hand. I just withdraw it from them. They seize it.
You have them.
Perhaps it is time the Nigerian government get its citizens out of China. As is suggested in the video, Nigerians are being kicked out of their homes. They're being made to go through inhuman treatments in China, and this could be the case in some other countries. However, this is sad because the Chinese citizens, foreign nationals in Nigeria, are given red carpet treatment in the country.
You didn't communicate to us that you are going to go to all the Nigerian houses.
It was another briefing by the Presidential Task Force, and today the Secretary to the Government of the Federation, SGF, took the advantage of the meeting to correct what he called a misrepresentation from yesterday's parley with the leadership of the National Assembly, where he was quoted as saying he never knew Nigeria's healthcare was in such a bad state. Mr. Boss Mustafa explains that he has always known the situation, but that currently his new task has given him a broader understanding of the healthcare system.
The discussion, the COVID-19 pandemic, has provided both arms of government a unique opportunity to significantly assess and agree to reform our public health system in the short, medium and long terms. I wish to thank the National Assembly under the leadership of the President of the Senate and the Speaker of the House of Representatives for their invaluable guidance and commitment to deploy all legislative resources and powers to support the fight against COVID-19 virus. On the issue of face masks, the Presidential Task Force is developing a national policy on its usage, and Nigerians will be duly informed as soon as the policy is finalized. Let me use this opportunity to commend and thank our frontline health workers for their commitment and sacrifices. The nation appreciates you and shall do everything possible to protect you. The government is concluding on the issue of your incentives, medical and life insurance, as you battle to save lives. Yesterday in the National Assembly, I mentioned at the National Assembly that I became fully aware of the state of our medical system during the execution of this task force assignment. It has become clear that this has been taken out of context. I must clarify that I am aware, and has indeed been a champion for the reform and transformation of the healthcare system. And in my modest way, even in my community, I'm working assiduously to see to the improvement of the healthcare system in my small community.
For the Minister of Health, Dr. Osage Hanire, a lot of progress has been made by the Ministry and the Nigeria Center for Disease Control, NCDC, in contact tracing, but a lot more can be achieved if all hands are on deck.
The Federal Ministry of Health, through the Center for Disease Control, is increasing testing capacity continuously. And as of today, we have about 10 laboratories capable of testing COVID-19. We have 2 in Abuja, the National Reference Laboratory in Gadua, and the Defense Reference Laboratory in Mogadishu, Abuja. We have 3 in Lagos, appropriately because of the cases they have. And they are the laboratory in Luth, the Lagos State Biosafety Level 3 Laboratory, and the Nigeria Institute of Medical Research. We also have testing capacities in Nurua, in Oyo State, in UCH, Oyo State, that's Ibadan, and the Federal Teaching Hospital Abakaliki, and the Africa Center for Excellence in Genomics in Ede. There are other states that are on stream: Kano, Borno, Kaduna, Sokoto. The NCDC supports response activities and preparation in all states through timely deployment of rapid response teams to every outbreak state, and they contribute significantly to improving contact tracing, case management, risk communication, infection prevention, control, and also by providing training, guidelines, and personal protective equipment. The Federal Ministry of Health's COVID-19 Accreditation Committee is inspecting public and private treatment centers and following strict infectious disease management protocols in order to increase bed capacity for COVID-19 isolation and treatment nationwide, and to protect health workers from harm. They will soon start this inspection and accreditation tour to all states, beginning with those with active COVID-19 cases. The bed space expansion starts with our federal tertiary hospitals, who will also be the centers for ICU at the beginning, where separate wings have been reserved and converted for COVID-19 management.
In the meantime, the Nigeria Center for Disease Control, NCDC, confirmed 14 cases of COVID-19 yesterday, with 13 new cases in Lagos and 1 in Delta State, bringing the total number of confirmed cases to 288, and the states affected in the country to 16, as well as the Federal Capital Territory. There's a breakdown of the cases in each of the states, putting Lagos at 158 cases, the FCT 54, Osun with 20, Edo State has 12 cases, Oyo 11. Bauchi has 6 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State. Enugu, Ekiti, Kwara, Rivers and Delta each have 2 cases. Ondo, Benue and Katsina States recording 1 case each. So far, 51 persons have been discharged, 7 deaths recorded. From Nigeria's President Muhammadu Buhari, it is a message of hope this period. At his Easter message, he expresses as unusual and very unfortunate the majority of Christians who find themselves marking Easter in a subdued manner away from the usual congregation in churches. However, the president says, quote, "I wish to enjoin our Christian compatriots to rekindle their faith in Christ, who overcame persecution, sufferings, and displayed endurance, steadfastness, and above all, piety." He asked all to imbibe and live the values of humility, discipline, perseverance, sacrifice, and obedience, which Jesus Christ demonstrated during his stay on earth. He used the occasion to commend the encouraging containment and ameliorating strategies put in place by members of the Presidential Task Force on COVID-19.
We have only 3 active cases in Bauchi, 1 discharge. There is no death.
The governor of Bauchi State making his first public appearance in Bauchi Township after testing negative for COVID-19. Governor Bala Mohammed had announced on his Twitter handle that a second test for the disease returned negative. He was the first governor in the country and the first person in Bauchi State to test positive to COVID-19. Our correspondent Hajara brings us this update.
The first index case, the person of the governor of the
This is the official residence of the Bauchi State Governor. It was in this building he spent 17 days in isolation and had enough strength to recover from COVID-19. The governor has made his first public appearance last night where he addressed journalists. He described his experience as a terrible one and a trial, having suffered COVID-19 the same time his brother was kidnapped.
I'm sorry for any inconveniences that I might have caused anybody in Bauchi or in Nigeria. It is not my wish to be infected. But certainly this has shown me enormous love, respect and regard to myself and to my family. The double jeopardy that I had to go where my brother was also arrested or kidnapped has also shown me so much love and prayers. I thank the people of Bauchi. I thank the people of Nigeria, especially our supporters, for their prayers and whatever they have done. They have kept vigil, they have offered sacrifices and sadaqah, and they have done so much. I have a plethora of calls from high and low, and I am so emboldened and humbled. I have now known leadership is a burden, and I am really ready to work in a better and more informed position, because my solitary position has almost made me a monk, but not in the sense of the Chinese adage. It has made me to reflect, it has made me to think and to see things from various perspectives and to even strategize.
Now back to the viral video of Nigerians being maltreated in China. During the question and answer session, our correspondent Friday Kurigwe, during the Presidential Task Force briefing, inquired as to the allegations, and this was the response from the Secretary to the Government of the Federation.
We met with the Chinese ambassador yesterday to convey to him our concern about what information is coming out. I saw some of the the clips that are being run on social media. But I must commend the efforts of our officers there, our diplomatic officers in China, because in one of the videos I saw was one of our officers holding Nigerian passports, and he was confronting the Chinese official and asking him whether he had the right to do what he was doing. And I think we are taking steps. And the first step diplomatically was to invite the ambassador to formally lodge that complaint. And I believe that we will receive positive response to that. But I can assure you that it is the responsibility of the Nigerian government to protect our citizens wherever they are on the face of the earth. And we will not renege on that responsibility. We will do everything to assure them and secure their protection, and to such a time that if they desire to return home, we would also work towards facilitating that for them to come back home.
We have more in a moment on our COVID-19 updates. To join us again.
The first 14 days is acceptable by us. Another 14 days, you didn't communicate to us that you are going to do another 14 days after 14 days. They have tested negative, and then they have given them the paper. Why are they giving them another 14 days? That is one. Two, all the police, the documents, these passports belong to the federal government of Nigeria. In line with international practice, no any country have the right to seize the international passport of another country. Wait! They are not in my hand. I just withdraw it from them. They seize it.
You have that.
I said they seize it. And then you know, your deputy, the deputy general, all the passports of Nigeria they seize. Ask him, he was released yesterday. Why are they seizing Nigerian passport? It not belong to the China. If you seize Nigerian passport, it's like you are seizing Nigeria as a whole. It's not acceptable. That's another thing. The third one I'm going to tell you, you didn't communicate to us that you are going to go to all the Nigerian houses and then you are going to ask them to come out and go and quarantine them. Did you communicate to us? No. Nobody communicated to us. If you want to do your policy of 14 days, shut down everybody. Don't discriminate. Everybody, you sit at home.
Welcome back to the program. We continue with this issue, especially of the viral video which we started with about the treatment of Nigerians in China. Joining us via telephone now is Ambassador Joe Keshi, former Permanent Secretary, the Ministry of Foreign Affairs. He joins us via telephone from Abuja. Thank you, Ambassador, for your time. All right, appears we've lost him, but let's quickly bring you this story. We'll try to get a hold of him on that issue. And this is with regards to the measures states are taking this period. Let's begin in Akwa Ibom State, where the COVID-19 lockdown is still in force. In a statement by the Commissioner for Information, Mr. Charles Udo, the quarantine and restriction of movement regulations 2020 is still in place. And here's a list of what the government says. Churches, religious gatherings are allowed on Friday, today, April 10, and Sunday, April 12th, but must comply strictly to these guidelines. All congregations must not have more than 20 persons, importance of hand sanitizers, and of course, washing of the hands. Elsewhere, in its determination to get rid of COVID-19, the Ekiti state government is not leaving out correctional centers. Now, the government is partnering relevant bodies to fight the pandemic and other fatal infections around. This collaboration hopes to bring those behind bars, officers working at the centers, to get the needed attention, protection around their vicinities and not lose sight of other infectious diseases that exist before the global pandemic. For the Sokoto State government, it is an extension of the closure of its interstate entry point order in continuation of its efforts to fighting the COVID-19 pandemic. Chairman of the state's task force on COVID-19 announced the extension while addressing journalists after the stakeholders meeting to review the initial 2 weeks closure of the state's entry points. Over in Adamawa State, where the COVID-19 Compliance Committee has appealed to the federal government to allow the Federal Medical Center Yola run tests on suspected COVID-19 cases in the state. The Adamawa State Commissioner for Health, while giving the update, says the laboratory facilities at FMC Yola is optimal and can successfully conduct tests on suspected cases without going through the rigors of sending samples to Abuja. Just saw we have Ambassador Joe Keshi back with us. We'd like to thank you for joining us. I must ask, the reports coming in, the video we're seeing about the inhumane treatments to Nigerians in China, what do you make of them?
I think it's very unfortunate, to say the least, that the Chinese, have gone to such a length to dehumanize Nigerians living in China. But I think we should commend both the minister who has called in the Chinese ambassador to launch a protest, and the officer on the ground who has very strongly raised protests and questions about the treatment of Nigerians on the ground. This is what he's supposed to do, and I believe that the Chinese would definitely, no matter what precipitated this, I believe the Chinese will eventually, come to their senses and normalize things.
The Secretary to the Government of the Federation has talked about the efforts the federal government is taking, some of the measures, but how decisive do you think some of the measures we should take or the stand we should take as a country, and that's Nigeria, with regards to these reports we're getting?
Well, look, when things like this happen, the first thing is what is going on, diplomatic contact between the two countries. As I said, the intervention of the minister, he has called in the Chinese ambassador, which is very commendable. And he has, certainly the Chinese ambassador is going to pass on to his own country Nigerians' displeasure at what they've done. And I'm sure when the Chinese themselves see the encounter between the consul general on the ground and the officials, I think they are going to do the best they can to, to reverse whatever plans they have in terms of testing and so on. We have a fairly good relationship with the Chinese, and I don't think this is an action directed by the government, but it could be over the overzealousness of some officials. So I look forward and I hope that this will be amicably resolved.
Nigerians there do sit and wait?
Beg your pardon? Come again.
What should Nigerians there in China and perhaps other countries who are being maltreated, what should they do? Sit and wait for either governments to discuss?
No. We do not have all the details to start with, and on the basis of what went on. If they are in such danger and the Chinese refuse to change, whatever they want to do, then it means that time has come to see how we can bring those Nigerians home. But if it's something that can be resolved and they can go back and to their normal duties and trading or whatever they are doing in China, that is okay. I just think that we should all be patient in this country and allow the diplomatic process to play out its course.
Ambassador Joe Keshi, former Permanent Secretary, Ministry of Foreign Affairs, thank you for joining us at this time.
Thank you very much for having me.
All right. Also joining us here in Lagos is Dr. Adebola Adejimi, consultant, public health physician. Thank you for your time.
Thank you very much.
All right. Talking about stigmatization, this was actually going to be my first question, and that is, we're getting a lot more discharged patients of COVID-19, but the Lagos State government has insisted and is asking people not to stigmatize those who are coming back from this. Can we avoid this, and how can we help them?
So a lot of cases are coming out now, which is a good story, which is good news for the community to know that we can actually survive this infection, and they should not stigmatize all the people that have been infected. So it makes sure we should not stigmatize them so that other people can actually still come out from wherever they are and also seek for health care. Because if we keep stigmatizing everyone, it means that people will still hide in their coffins and they will not want to come out for the proper treatment to be taken care of. So we should educate the community, educate all the members of the community everywhere they are, using the community leaders, the opinion leaders, everywhere we have the power to do the education to make sure that everyone is not stigmatized, because it's a new infection and we are all getting to know about this infection
together. Well, seeing as you're also part of the contact tracing consultants, how is that going? That's the active case search in Lagos.
Okay, the active case search is going on. There are two strategies. We are using the healthcare facility and the community to search for cases that can actually show the symptoms of this infectious agent. And then we are looking for cases like people that have acute fever, cough, or difficulty in breathing, or any history of unknown respiratory illness that is not clear to anyone. So we go to health facilities to check the records in the past 4 weeks to see who has presented with this case and the outcome of their infection. Also go to the community house to house to find out who has all this kind of ailment in order to be able to tag them early and hand them over to the case investigation team for further screening and investigation if necessary. And this is very important in order to get more of these cases out from the community, because we need to stop this community transmission, and then we need to actually end this infection. We need to encourage our community members to support the healthcare workers in this activity, because we've heard of stories of cases where the community volunteers are visited and they are actually violent towards them. So we need to tell everyone to support them because they are working towards the good of everyone. They should not be scared of them because we are also observing the public health measures to make sure that this infection is not transmitted from one person to another. And then we don't have personal contact with anyone. We are using electronic collection of data from them. So we need their support. We need the community support. It's a collective effort and collective responsibility of every one of us in order to make our community safe and healthy.
So this holiday, Easter break, will you also be going around?
Yes, we are still working. We are still going around this holiday period. We are still going to different houses and different health facilities. Some people may be called on phone if they have visited their facility in the last 4 weeks. So they should also give true information about what is happening, their travel history, the outcome of the infection, the contacts, and also if there's anybody that has a probable cause of death through this unknown respiratory illness, we should also have that documented.
All right, we appreciate your time, Dr. Adebola Adejime, consultant, public health physician. Thank you for joining us on the program.
Thank you very much.
And we also have some of the updates, live feed from the NCDC and the World Health Organization with more information on this pandemic in Nigeria and across the world. Also remember, in the past few weeks, the world has changed very quickly, but we need to stay at home to break the transmission chain and save lives. I would like to thank you for watching. Remember, another update comes up on the coronavirus pandemic at 9 p.m. Be sure to listen then. We're just getting new information. Might just stretch to get this, and that is the leadership of the House of Representatives expressing his displeasure over the inhuman treatment meted out on some Nigerians by Chinese authorities in Beijing. Speaker of the House of Representatives, Mr. Femi Gbajabiamila, said this at the meeting with the Chinese ambassador to Nigeria. He demanded that the inhuman treatment of Nigerians must be addressed forthwith. He went ahead to confront the ambassador with the post video of the incident, and he said the viral media reports show Nigerians being forced out of their hotels. So he's asking for an official explanation. Those are the updates. Don't forget, 9 p.m. is another update. Thank you for watching. I'm Millicent Walker. Bye for now.